Okay, welcome to today's educational expedition. And today we are going to be talking about prescription drugs. And we're doing a little bit different presentation than I usually do, in that I'm using a presentation that was put together by another entity. And this particular presentation is going to focus on teens and maximizing your role as a teen influencer. So what you can do to help prevent teen prescription drug abuse. So that's going to be the focus of this presentation. And this program is made possible in part by educational grants from Purdue Pharma and the National Association of Chain Drug Stores Foundation. Not usually a big fan of Purdue Pharma or national drug chains, but this is a fairly good presentation, and so kudos to them for making it, and I would like to share it with you today. So I'm going to give you just a little bit of an overview. We're going to do things a little bit differently today in talking about the misuse of prescription drugs by teens. And this is a growing public health problem that places many teenagers at serious risk. Whether you're a parent, teacher, coach, school administrator, a community or school-based health provider, you need to be in the know when it comes to teens abusing or feeling pressure to abuse prescription drugs. The same ones that we keep in our medicine or kitchen cabinets even for easy access. So I am Cheryl DePaolo. I am the director of the Ulster Prevention Council, and we provide prevention services throughout Ulster County, New York. And we're going to just jump right in. So today's goals. So the main goal of the workshop is to help teen influencers, parents, grandparents, teachers, coaches, school nurses, and resource officers, or community-based health professionals understand the risk of prescription drug abuse among teens and how you can take action to help lower the risk. I'm going to give a brief overview of this troubling trend, the extent of the problem, what motivates teens to misuse or abuse prescription drugs, how they access these drugs, which ones are commonly abused, as well as possible red flags indicating that a teen might have a problem. And then we're going to tackle some common myths, and we'll review the powerful role that you can play in educating teens about the dangers of prescription drug abuse and helping to promote healthy alternatives. And finally, I hope each of you will help to carry today's message forward, whether it's raising the subject with teens that you interact with, helping to implement drug-free activities within your schools or communities, and or engaging other teen influences by sharing these materials. So what is RX drug abuse? The misuse of RX drugs is a growing under-recognized problem that puts young lives at risk. And use includes self-medication and recreational use of these medications. So let's keep in mind that when taken by the right person at the right dose, at the right time, and in the right way, these medications are incredibly valuable. Prescription drugs help cure certain diseases, relieve symptoms, and restore quality of life. However, the misuse or non-medical use of these drugs is very dangerous and can lead to overdose addiction and even to death. So while the rate of tobacco, alcohol, and illicit drug use is down overall, more teens are turning to prescription drugs. And so we'll see some stats here. 1 in 5 teens reports abusing prescription drugs. 1 in 3 teens report there's nothing wrong when using prescription drugs every once in a while. 1 in 3 teens report knowing someone who abuses prescription drugs. And every day, almost 2,500 teens abuse a prescription drug for the first time. Prescription drugs are abused more than cocaine, heroin, ecstasy, and methamphetamine combined. these numbers paint a sobering picture and it's a problem that needs more attention, then it needs to be consistently addressed at home, in school, on the field, and in doctors' offices. Okay, so dangers of abusing prescription drugs. This can be very risky, and the number of overdoses and even deaths associated with the abuse of these medications has increased dramatically. So some dangers are increases in blood pressure or heart rate, damage to the brain and other organs, accidental overdose or poisonings, physical dependence, and addiction, disruption in breathing, seizures, death, and then there are risks associated with mixing multiple drugs or combining them with alcohol. So teens take these drugs, sometimes mixing them with alcohol and other substances, not knowing what their effect might be. We know some teens will abuse different classes of drugs for their practical effects. Maybe one to help them to focus and take the edge off, and another one to help fall asleep. Any teen is susceptible to engaging in risk-taking behaviors. So the teen years are a time of tremendous uncertainty and experimentation. And teenagers find themselves on an unsteady road of self-discovery, sometimes, and they constantly compare themselves to their peers. They want to be accepted, and at the same time, they push the limits of their independence. They feel the pressure to do well in school and get into a good college, all the while dealing with the angst of puberty, including physical changes and surges in hormones. And because the teen brain is not yet fully developed, teens' impulse control, judgment, and ability to make sound decisions is not as good as they or you might think. It's no wonder they are vulnerable and in search of a release from all of the stress. Unfortunately, prescription drugs are also a noticeable part of teen culture. And one trend is called farming or bowling parties, where teens will mix different kinds of prescription drugs together in a bowl or a bag, also called making trail mix. And they'll just take a handful of pills without knowing what drugs they're taking or how they will affect their mind or body. And nor would medical professionals, responders in the event that they need to treat a teen and counteract the drug's effect. So that's a dangerous. I don't know that it's going on as much as it was a few years ago, but we have seen it as a trend. So why are teens abusing prescription drugs? We've already mentioned some of these, but there are many reasons. They're easy to get. To thrill seek, these drugs offer a quick high, especially if they crush or snort certain medications and it's the thing to do. Their friends are doing it. Thrill seeking is part of the adolescent brain. The brain craves that kind of exciting amygdala experience. And so that is something that they look for. To escape problems or self-medicate so that they'll have a better handle on their lives. They'll often turn to drugs to reduce stress, get sleep, boost their mood, or enhance concentration or performance. And if they lack self-esteem, which many teens do, they may turn to these drugs to take the edge off and perhaps to be more sociable. And they also feel that these drugs are perceived to be a safer alternative with fewer side effects than illicit street drugs because they're approved by the Food and Drug Administration or they're given by a doctor. There may be less stigma to using them than using street drugs, and they may feel that their parents will be less likely to disapprove of these drugs compared to other substances. So why are teens abusing prescription drugs? Well, they may be looking for help. Unlike with other forms of adolescent drug use, the desire to feel good or get high ranks much lower as a motivator for prescription drug misuse. More often, teens turn to prescription drugs to help manage their daily lives. For example, to lower their stress and anxiety, to boost their mood or to increase their performance. Some other factors that are driving this trend, one of them is accessibility. So the medicines can be found in homes of family or friends. So a lot of the work that we do is to try to get people to lock up their meds, to get rid of old medications and not keep them around for another occasion, to just not make them so available. They're appealing to teens because they're typically easy to get and typically free to them. And teens also see that mom or dad or grandma take them and seem fine, so what's the harm in using them? There's an overall lack of awareness about the problem. And fewer parents and teens are actively talking about drug and alcohol abuse. And we know that when parents express strong disapproval of drug use, teens are far less likely to engage in drug-taking behaviors. So parents and other trusted adults must look for teachable moments to talk about the issue. And that's one of the things that we're going to cover. Another factor that drives this trend is the feeling of invincibility. Teens mistakenly believe that it's safer to abuse prescription drugs than illicit drugs, even if they're not prescribed by a doctor for them. They also think these drugs have fewer side effects and are not as addictive. And they may see no problem sharing medications. The reality is that prescription drugs are only safe to use at the dose they've been prescribed for you by a doctor who knows your health history. And it's illegal to be in possession or distribute controlled substances like strong pain medications called opioids, which many teens are after. Another factor driving this trend is our pill-taking society. These medications are all around us and teens notice. Prescription drugs are often a mainstay of treatment for various illnesses, including migraine, infections, heart disease, diabetes, depression, arthritis, cancer, many others. TV and print media are also filled with ads for these medications, so teens may come to believe there's a pill for everything. And in general, Americans aren't well informed when it comes to medication safety. Most of us need to be better educated about how to safely use, store, and get rid of these medications. So we'll talk a little bit more about that later. Where do teens get drugs? Sources of pain relievers for most recent non-medical use for teens older than 12. So it's easy for teens to get their hands on prescription drugs. They're often as close as the nearest medicine cabinet. The majority of teens, 8 out of 10, get prescription drugs from friends or relatives by either stealing them, buying them, or simply asking for them. Less often, teens will get them by getting a prescription from a doctor, buying them from drug dealers or other strangers, or by purchasing them online through pro-drug or illegal internet pharmacies. We do see a trend for many different drugs to be available on the internet. So we're going to spend a little bit of time talking about the different kinds of prescription drug medications. I'm not going to spend a lot of time on pain relievers since we recently did a webinar on opiates, and you can go back and listen to that. These are drugs that are used to relieve moderate to severe pain. They block pain signals to the brain, and they're abused by teens to get high, increase feelings of well-being. And some examples of that are Vicodin, OxyContin, Percocet, Lorcet, Darvon, codeine, morphine, and methadone. We're going to talk a little bit more about stimulants, and these are drugs that are primarily used to treat ADHD symptoms. They speed up brain activity, causing increased alertness, attention, and energy. And they were first marketed in the 1930s as Benzodrine in an over-the-counter inhaler to treat nasal congestion. But by 1937, they were available by prescription in tablet form and were used in the treatment of the sleeping disorder, narcolepsy, and also in ADHD. Common prescription amphetamines include amphetamine and dextroamphetamine, Adderall, dextroamphetamine by itself, dexedrine, lisdexamphetamine, which is known as Vyvanse, and methamphetamine, which is available by prescription under the name Digoxin. And the effects of amphetamines are similar to cocaine, but their onset is slower and their duration is longer. So we should note that for students who have ADHD, taking the stimulants, including amphetamines, has kind of a paradoxical effect on them and actually slows things down rather than speeding them up. But these are pretty typically used as aid to study drugs in students who don't have ADHD and perhaps want to stay up at night and study all night. And they have a different effect than for someone who truly has ADHD. One of the really interesting things to note that I found recently was the high number of Major League Baseball players that have exemptions so that they can take these drugs, and they're taking them at much higher rates than the rate of ADHD in the general population. Physical effects, increased blood pressure and pulse rate, insomnia, loss of appetite, and physical exhaustion. Overdose effects of stimulants include agitation, increased body temperature, perhaps hallucinations, convulsions, and possibly death. So these are Schedule II stimulants, which mean they have a high potential for abuse and currently acceptable medical use. Pharmaceutical products are available only through a prescription that cannot be refilled. So you need a new prescription each time. And then we'll talk a little bit about depressants, sedatives, and tranquilizers. Depressants induce sleep, relieve anxiety and muscle spasms, and prevent seizures. Barbiturates are the older class of drugs, and they include butalbital, which is also fiorinol, phenobarbital, pentothal, seconal, and nembutal. When I worked in rehab, we just called them all together the nols. A person can rapidly develop dependence on intolerance to barbiturates, meaning that a person needs more and more of them to feel and function normally. This makes them unsafe, increasing the likelihood of coma or death. Barbiturates are depressants that produce a wide spectrum of central nervous system depression from mild sedation to coma. They have also been used as sedatives, hypnotics, anesthetics, and anticonvulsants. And they're classified as ultra short, short, intermediate, or long acting. Barbiturates were first introduced for medical use in the 1900s, but today few of these substances are in medical use, as opposed to even just a few decades ago. They come in a variety of multicolored pills and tablets, and users prefer the short-acting and intermediate barbiturates such as Amitol and Seconal. They're generally abused to reduce anxiety, decrease inhibitions, and treat unwanted effects of illicit drugs. Barbiturates can be extremely dangerous because overdoses can occur easily and lead to death. A class of drugs known as benzodiazepines have a longer duration of action, and they're utilized to treat insomnia in patients with daytime anxiety. These benzodiazepines include alprazolam or Xanax, chlordiazepoxide, which is Librium, chlorazepate, which is Tranxene, diazepam or Valium, halazepam or Paxipam, and lorazepam. There's also Ativan, Cerax, Prazapam or Centrax, Doral, and one that we see prescribed a lot recently is clonazepam or Klonopin. But there's also diazepam and chlorazepate. So all of those are benzodiazepines. And abuse is frequently associated with adolescents and young adults who take the drug orally, or they might crush it up and snort it to get high. Additionally, opioid users often co-abuse benzodiazepines to enhance their euphoria. And they're associated with amnesia, hostility, irritability, and vivid or disturbing dreams. Benzodiazepines slow down the central nervous system and may cause sleepiness and a relaxed mood. So overdose effects include extreme drowsiness, confusion, impaired coordination, decreased reflexes, respiratory depression, coma, and possibly death. Overdose effects of use of benzos and opioids include profound sedation, respiratory depression, coma, and death. and benzodiazepines are controlled in Schedule 4. So it's important to note that benzodiazepines are one of the few substances that have a very difficult detox, takes a really long taper, and it is very dangerous to detox from benzodiazepines. The other category that has a very dangerous detox is actually alcohol, is one of the more dangerous ones. Some physical warning signs to look for with anyone, but we're concentrating on youth today. But it's very important to watch for signs of problems, and the physical signs will be different depending on the individual and the drug that's abused. The ones listed here are general: excessive sweating, urination or thirst, nausea and vomiting, uncontrollable diarrhea, spastic shaking, drowsiness, dizziness, insomnia, loss of consciousness, physical dependence, addiction, and possibly being hospitalized. We've created an additional sheet that lists warning signs by drug category according to pain, medication, stimulants, sedatives, tranquilizers, that is available if you're looking for it. Some of the behavioral warning signs of use: sudden mood changes, including irritability, negative attitude, personality change, extreme changes in groups of friends or hangout locations, lying or being deceitful, unaccounted time away from home, missed school days, avoiding eye contact, losing interest in personal appearance, extracurricular activities or sports, poor performance at school, borrowing money or having extra cash, and visiting or even purchasing from pro-drug abuse or illegal websites. And so these are kind of general behavioral warning signs for any substance use disorder, but particularly the buying things online applies to this category of drug. Most of these are pretty general. So I just want to talk a little bit about influencing teens and trying to help in ameliorating this problem. So when we look at people that can make a difference, we're looking at what we call teen influencers, which is what this particular slideshow was made for. So whether it's parents, grandparents, aunts, uncles, teachers, coaches, guidance counselors, administrators, school nurses, school resource officers, and us, community-based healthcare professionals, we can make a difference by educating teens and other teen influencers about the risks of prescription drug abuse. There's a saying in public health to go where the people are, that the only way you can make a measurable difference in prevention and health behavior change is to talk directly to people. So teen influencers who interact with teens on a regular basis can look for teachable moments to talk to teens about the dangers of prescription drug abuse and to promote healthy alternatives, which is really a big deal for youth and their brain development, is that having healthy alternatives, fun things to do, other ways of relieving that anxiety, which may lead to taking these substances, is very important. Parents have the greatest influence on teens' drug use, attitudes, and decisions. And teens whose parents talk about the risks of drugs at home are up to 50% less likely to use drugs. Grandparents, older siblings, and other relatives also play a big role in shaping teens' decisions. And they're also in the best position to reduce access by locking up medications and properly disposing of expired or unused medications, which is the major way that these are obtained. As far as educators, students spend at least 7 hours a day at school, not currently. When they're in school, often they more time than what is spent with parents. And school may be the place where they can find a supportive adult to talk to. And educators or counselors might also see behavior changes and be able to intervene before parents do. They might see drops in academic or athletic performance, acting out in class, or unexplained absences before parents, and can often intervene early. Healthcare providers are also teen influencers, and they can keep tabs on teens' physical and emotional development. They can identify problems and also help combat prescription drug abuse, where it might start by educating all patients about the safe use of medicines in their home and when necessary in school. And they can talk with those who show signs of being at risk. Can also help in helping make parents aware of any problem that they may be seeing. So we know that talking to teens works. Rates of substance abuse by teens have declined dramatically in the last decade, due in large part to collective efforts of anti-drug and prevention communities and communicating the risks. As the perception of risk goes up, teen willingness to abuse or misuse a substance goes down. So talking to them about the true dangers of drug abuse in an ongoing direct way is critical. And I would add that also talking to them about the really legitimate reasons that they may feel that they need to seek out a drug is also very important. So sometimes we only focus on harm. And one of the things that we know about working with teens is that looking at potential harm is important, but also so is looking at the reasons that they're using and the benefits, the perceived benefits that they see in using. So a lot of times a teen won't feel inclined to stop using because they really don't feel that their life would be better if they stopped. So that's one of the conversations that needs to take place. So in talking to teens about prescription drug abuse, what we would professionally call a brief screening or an intervention might just be a conversation in the hallway or in the car or out on the field. And we should take opportunities to talk with teens. Even a brief conversation can help steer a teen in the right direction. It's important to empathize with the pressures and uncertainties they face and validate their stressors. So they may be feeling pressure to excel academically or get into college, to fit in with their peers, to find their place in the world. And also they may need healthy alternatives for coping, such as exercise, picking up a sport, drug-free social activities. And we really need to get creative with youth in finding those healthy alternatives, because we know that not all kids are interested in picking up a sport or mainstream activities. So being really aware of what their interests are and what resources might be available to them. One of the things that has been happening in the schools here in Ulster County is that we've been offering some relaxation, some breathing exercises, mindfulness, meditation, that kind of thing, to give teens other coping skills. And then, although teens might think that everybody is doing it, we need to kind of really denormalize the behavior. So while 1 in 5 teens are abusing prescription drugs, and that's a high number, 4 out of 5 are not. And then just to set the record straight about the dangers of prescription drug abuse and present the facts. So we need to really inform teens and others that abusing prescription drugs is just as dangerous as abusing street drugs. And it can also be as addictive and deadly. There's no safe way to get high, and it's not okay to rely on these drugs to help manage stress, even every once in a while. And for parents, setting clear limits and a good example. Let teens know you'll be disappointed if they use. Amazingly, that is very important to teens. They really don't want to disappoint people around them. And also being aware of how we use medications in front of teens. And I noticed this even with my granddaughter, who's only 9, that she's very acutely aware when she sees somebody taking something, and she kind of wants to know what's going on and who has a lot of meds. And I know that she's very acutely aware of that issue. And talking to teens about prescription drug abuse, it's important to give them a way out of using, especially if they're feeling some sort of peer influence. talking to them about how to get out of a bad situation. So things like offering to pick them up wherever they are if they are ever in trouble, and letting them know that there won't be any punishment involved in that, that if they're in trouble, whether it's an unsafe situation because of drugs or alcohol or any other reason, that they know that you will come and get them if they need to do that. And then suggesting responses that they can use. And we practice this with youth a lot and kind of role play with them to gain some confidence and some reasons that they can use so that they don't feel uncool. So things like, I don't want to ruin my season or get in trouble with the coach. I have to do something with my parents really early in the morning. I'm the designated driver, which is seen as kind of a cool role right now, that everybody needs one of those. I'm not interested, or just plain no thanks, just giving them the words to use and letting it be something that feels more natural to them. Some of the challenges to reaching out to teens, um, they can be rebellious and want to experience life and do new things. And sometimes some teens want to be that 1 out of 5. They would rather be in the minority than in the majority on anything. They don't want to really be seen as conforming. And so that may be an issue. Peer pressure. And when I talk to youth, I don't talk about it so much in terms of peer pressure, because they will say that they don't experience peer pressure, but they do experience uh, peer influence. They are bombarded with opportunities to try new things with their peers. And one of the bits of research that's really interesting is that the more teens or young adults that are together and doing something, the easier it is to go along with the crowd. And so the higher the numbers that are kind of congregated go, the more likely there is to be some influence and going along with the crowd. And they have poor judgment. So teens have this bit where they think that they're invincible or nothing can hurt them, and they don't really experience it in those words, but they will feel like that happens to other people. It can't really happen to me. That's other people that will happen to. They also have this fast-paced information age. They have tons of competing messages competing for their attention. Uh, this is a little bit old with the iPod, but social networking, pop culture that normalizes drug use, pop icons like celebrities who make the news with tales of prescription drug use. And all of these things compete for their attention, that leaves fewer opportunities to talk. They can also do their own research on the internet, and there are a lot of sites that have pro-drug abuse information. The most common one is Erowid, EROWID, and that site just has tons of information kind of encouraging drug use, having people talk about their ways that they've abused drugs, and even the bad things that happen, the good things that happen. And that's a very popular site, but there are many like that, message boards and things like that. So ways that we can help. So we know that kids learn by example. So when they see someone around them, mom, dad, a sibling or grandparent taking a pill, it doesn't seem so bad. So if you take medications in front of someone else, explaining why and stressing the fact that there are powerful medications that are only safe to be used by the person for whom the doctor recommended, and also locking them up. So it's very common for youth to kind of pay attention to when someone has an injury or an illness and has the medication. It is pretty common for teens to go through the medication cabinet, and most people don't really keep track of their medications too well. So it's important to monitor all medications in the home, both prescription and over-the-counter medications. And we did talk in a previous webinar about over-the-counter medications and how they can be abused, especially medications with DXM and alcohol in them. And safely storing medication in a dry, cool place. So the bathroom medicine cabinet really isn't a great place anyway. It's warm and damp, but also people lock themselves in there to use the room. And so it kind of can give them an opportunity to go through the cabinet. Not stockpiling prescription drugs and keeping them in a safe place out of children's sight and reach. Many people save medications, especially antibiotics, pain medications, and sleep medications for themselves or other family members to use in what they'll call an emergency situation. Don't give your medicine to someone else. So you never know how a medication is going to affect someone, even if you think that it would help them. And properly disposing of older unused medications. Um, Most prescription drugs can be put in a non-see-through container mixed with coffee grounds or kitty litter and thrown in the garbage. We do have disposal bags here at Ulster Prevention Council that contain activated carbon that can be mixed with medication and thrown safely in the garbage. There are prescription drop boxes. In Ulster County, we have 19 one in each law enforcement location. And some pharmacies will also take back medications. And most medications should not be flushed down the toilet. It does go into the water, so it's not safe to get rid of medications in that way. So we need to work together to deter prescription drug abuse among teens. Everybody has the ability to talk to teens and let other teen influencers know about the problem. So I hope that you will take steps following this workshop to be one of the people that makes a difference by passing it on. You can give this workshop to other teen influencers and partner with other organizations or with a school or PTA. You can find out whether there are teen-driven initiatives locally and lend a voice. And enlist a medical expert to help deliver the message, share and tap into existing resources like our websites and social media, and engage local news media to increase awareness. So there are a series of handouts for parents, educators, and healthcare providers that go along with this series in maximizing your role as a teen influencer. And each one includes practical tips and strategies to help curb prescription drug abuse among teens at home, school, on the field, or in the local clinic or pharmacy. And there are a wealth of other resources as well. Here are some resources that can be downloaded. CADCA, Community Anti-Drug Coalitions of America. DARE has a website, the National Council on Patient Information and Education. NIDA, the National Institute on Drug Abuse. Partnership for Drug-Free America, Students Against Destructive Decisions, and also SAMHSA, the Substance Abuse and Mental Health Services Administration. And that is going to wrap it up for today. There are some references if you would like to see them. They are here. And as I said, this is a program that was put together by Purdue Pharma and the National Association of Chain Drugstore Foundations as part of the Educate Before You Medicate initiative. And here is my contact information. C. DePaolo at FamilyServicesNY.org. Thank you for coming, and we hope to see you soon on the educational expedition.